Coming to the color blindness, total loss of color vision is known as achromatopsia. In partial loss of color vision, the inability to distinguish certain colors is termed as color blindness. It affects 8% of males and 0.4% of females. The most common type is red-green color blindness. Color blindness is described with the help of the following terms. There will be use of these prefixes. Prefixes like prot, deuter, and trit are used to describe the red, blue, and green cone system defects respectively. Classification of color blindness. Color blindness is classified in the following manner. Trichromats, that is trichromatism. This is the commonest type. About 6% of the affected males are trichromats. These individuals with all the three cone systems, but one of the cone system is defective. Thus, ability of individual to recognize one of the primary color is decreased. Accordingly, trichromats can have one of the following defects, that is deuteranomaly, protonomaly, and tetranomaly. Tetranomaly is most common. Dichromats or dichromatism. About 2% of the affected males are dichromats. These individuals with two cone systems and the third cone is absent. Thus, dichromats can have any of the following, that is deuteranopia, that is most common, protonopia or tetranopia. Monochromats or monochromatism. These are the individuals with only one cone system present, thus they cannot appreciate any color because minimum two cone systems are required to appreciate a color. They see only black and white and shades of gray. Etiology of color blindness. The cause can be inherited or acquired due to the lesions or drugs. Genetic causes. Color blindness is inherited as X-linked recessive disorder. As males contains XY chromosomes in their germ cells, they develop color blindness if the X chromosome contains defective gene. On the other hand, the females develop color blindness only when both X chromosomes are defective, which is rare. The female having one defective X chromosome remains symptom-free but transmits the disease to half of her sons. Thus, females are the carriers and males are the sufferers. All the daughters of colorblind person become carriers and half of their sons suffer from this disease. Thus, color blindness manifests in every second generation males. Deuteranomaly and protonomaly are most common defects. Tetranomaly and tetranopia are rare and occur equally in both males and females. Lesions. Following lesion in the striate cortex, that is area number V8, the individual suffers from complete loss of color vision, which is called as achromatopsia. Drugs like sildenafil inhibits the enzyme phosphodiesterase and thus individuals develop transient blue-green color weakness till the effect of the drug lasts. Tests for color blindness. Color vision is tested by the following ways. First one is Ishihara charts. It is the most routinely used test for color blindness in clinics. It consists of lithotropic plates in which numerals or pathways are drawn in colored spots against background spots of different colors and sizes. The subject reads the number and traces the pathway. The colors of the numerals or tracings and background colors are arranged in such a way that a colorblind person reads them differently or traces different pathway from normal person. Then Edrich green lantern test. In this test, the light from lantern is shown through different colored glass pieces fixed on a rotation disc and subject is asked to name the colors. And in Holmgren's wool matching test, the subject is asked to perform a series of color matching from the collection of wools of different colors. Tests for color blindness is usually done as a part of health checkup for entering into professions like driving, flying, traffic services, railway, armed forces, and medicine. When there is loss of visual acuity, color vision is also affected. But in conditions like bilateral lesions of the inferomedial occipital region or optic neuritis, color vision is more affected. These are the example of Ishihara charts where the colorblind person reads it as a different number altogether, and here he traces